What if we could stop heart disease before it even starts? That's exactly what I was wondering. So I hopped on a Zoom call. Meet Dr. Ibrahim Karabayir, an AI researcher who was at the forefront of using AI to fight heart disease. I had a lot of questions for him.
So, to kind of start off at a basic level for listeners who might be new, how exactly do you use AI models in the context of cardiovascular health?
So it's really great question, and thank you for the invitation. It's really good to talk with you. So basically, we utilize AI to transform multimodal data into something useful for clinicians for the clinical decision-making process. So in my example, we actually utilize ECG data as a main input to predict, detect, and identify certain cardiovascular outcomes like cardiomyopathy, heart failure, peripartum cardiomyopathy, preeclampsia, sudden cardiac death, and certain biomarkers like brain natriuretic peptide, troponin, which are very important biomarkers for heart failure and myocardial infarction, respectively. So yeah, we are utilizing generally speaking, we are utilizing ECG data as a main input for these cardiovascular outcomes. And also, there is a way to utilize ECG data from variables. That's why we are kind of limiting our input data with ECG because in the end, we can enable these tools to be utilized on variables or variable paired devices.
So here's the science behind it. AI models analyze heart data from patients, everything from blood pressure to ECG readings, and use it to predict potential heart problems. These algorithms can detect patterns that are too subtle for the human eye to notice. It's never that easy though. With any breakthrough technology, there are risks, especially when lives are on the line.
So, I guess from your experience, what are kind of the most dangerous or pressing ethical challenges with using AI for this, especially in life or death situations?
So, I guess I can touch base on bias first.
Mhm.
So bias is very important. It is because, so assume that you have a machine learning tool based on 12 clinical variables, which is the case in the current literature. So basically, certain clinical factors like age, sex, hypertension, uh, body mass index, these are very important biomarker predictors for heart failure. But when we build a model saying that these are very important factors for this machine learning algorithm for heart failure, we generally cannot be able to generalize these models into different settings. So, for example, if there is like a resource poor settings, so generally speaking, hypertension information, which is important predictor for heart failure, wouldn't be reliable. That's why there's a bias. But for the ECG side, it is not the case. So basically, ECG as a universal input, and we can utilize this universal input to have more generalizable models compared to traditional risk calculators.
Okay. And when you're saying universal, do you mean a wider range of clients or I guess patients or?
When I say universal, I meant to say there are less human interacted input data. So basically, uh, so for example, hypertension could be, like I said, hypertension could be a factor for heart failure. But we know that, hypertension couldn't be identified for every patient, right? So there could be some misdiagnosis.
Mhm.
But ECG data is not like that. Basically, when a recorder put a uh, electrode on your body, it is electrode, it is mechanic. So basically, the output would be signal, and there's really less interaction with humans. So that's why it's kind of universal data, and utilizing this universal data with, of course, with a large amount of universal data, like large amount of ECG repository, we could be able to have more generalizable models.
I see. So it's kind of like less human error is involved in the process. So when you're deploying AI in healthcare, how do you take care of the transparency of the model and the patient? Like, for example, how do you quickly go from the result of the model to a diagnosis?
So, first of all, I guess all all clinicians should aware of this fact. Basically, we are only providing a data. This data is a transformation of multimodal data. So the data could be a prediction risk score for heart failure, prediction risk score for, I don't know, for cardiomyopathy. But it is just to help clinician. In the end, this will be the decision would be their decision. So that's why this is very important thing to kind of know for clinician. For transparency, uh, as you know, deep learning models is kind of black box, but we do have certain explainable AI algorithms to kind of understand which part of the ECG segment contributed too much for the risk score that we obtained. So yes, there is certain algorithms for explainable AI, and this will increase the confidence for clinicians when they make their own decision.
I see. So in the end, it is really up to the clinician. It's
Of
more of
course.
a tool. Okay. So how do you exactly, when collecting the data and training the model, how do you, I know you talked about bias earlier, how do you make sure that the data is diverse?
So diversity is really important, and we generally include all the patient data available for our model development process. But it is not enough to include all the patients for model development. We also need to validate these models on different patient groups, like based on races, based on their age. So it is more like problem specific. For example, for heart failure, there is no need to evaluate the model performance on patients with their with age of 5 or 10, because we know that it's for older people. So it is more like problem specific, but I should acknowledge that we should definitely include all the relevant patients, and also we should definitely evaluate our models based on these patient groups.
So you do testing on the patient groups using the model and see accuracy through that.
Yes, exactly.
I see. So I guess what kind of lessons have you learned from your experience working with healthcare and AI, and what do you think people should know about it?
One thing is very important, which is collaboration between the AI folks with the clinicians, because first of all, we need to understand the problem itself to kind of play around the model development and also data, all those details. So yes, we are pretty good in AI, so they are very good in the in the field itself. But there should be really good collaboration, really close collaboration between these two mechanisms to come up with really strong work.
Mhm. I've never actually heard that. Yeah, I didn't realize that, but I think that is quite important. So, what do you, I guess, see in the future with AI involving healthcare, and what do you think is essential when making something the most fair and ethical in these fields?
So I guess most important thing is to have really big data pool to utilize data from all over the world, not just United States, because diversity is really important if you come up with something generalizable. And also deep learning models, is always especially large language models is requiring lots of data to be trained on. That's why we need to in future we need to kind of have like a big data repository, including all those universities, institutions, companies, uh, to be later on utilized for targeted task. Because currently it's very difficult to collaborate with people from other universities because there are lots of challenges to get their data or to send your models. So, like I said, models requires huge data, and in general, in future, I guess there will be national efforts to come up with something similar, like I described here.
Despite the challenges, there's no doubt that AI is revolutionizing healthcare, particularly in preventing heart disease. By helping doctors in making more accurate predictions and taking proactive steps, we could be on the verge of drastically reducing heart-related deaths. This is just the beginning.